So we will study now allergic and immunological disorders of oral cavity. First disease is sarcoidosis, which is also called as Bismarck-Schaumann disease, which is similar to tuberculosis (TB), which affects lungs, lymph nodes, salivary glands, skin, and bone. Lungs, it causes granulomas, cause cough or upper respiratory or involve upper respiratory tract. In skin, it causes red colored lesions. In salivary gland, non-specific. In oral cavity, in bones, hyperkeratosis. To differentiate from tuberculosis, it will cause non-caseating granulomas. In TB, we see caseating granulomas. And multinucleated giant cells we see here. In TB, we see giant cells. Histopathology in giant cells, Schaumann bodies and asteroid cells. Schaumann bodies are basophilic lamellar calcifications, and asteroid cells are eosinophilic entrapped in eosinophilic cells entrapped in collagen fibers. Okay, now syndrome associated with sarcoidosis is uveo-parotid fever or Heathfoot syndrome, which is a triad of three things: sarcoidosis and parotid gland enlargement, facial nerve paralysis and fever, and anterior uveitis and which cause for blindness. Okay. The etiopathogenesis of sarcoidosis is unknown, but it is dysregulated immune response leads to formation of granuloma. Okay. Now, next disease is Wegener's granulomatosis, which is also an immunological disorder. Abnormal immune response towards an unknown antigen or inhaled microorganism. It is a triad of three things: necrotizing granulomas of upper respiratory tract and lower respiratory tract. Second, disseminated vasculitis. Third, necrotizing glomerulonephritis. Okay. Strawberry gingivitis is its characteristics. Here, gingiva is exophytic overgrowth of gingiva, show presence of petechiae, purplish reddish in color, hemorrhages. Okay. Diagnosis criteria are oral ulcers. Okay. Gingivitis, strawberry, oral ulcers. Oral ulcers can be seen gingivitis, nasal, strawberry gingivitis, and nasal discharge can be seen. Okay, second is finding related to chest, lower respiratory tract involvement. Third is urinary sediments, RBC casts maybe. RBC casts maybe. And fourth is granulomas in biopsy. Okay, now midline lethal granuloma. Okay. Given by exclusion, it is given by exclusion. It can come in question as an exclusion. This will involve this and accept this. Okay, so midline lethal granuloma is rapidly spreading and destructing sinus, face, palate, and pharynx. In sinus, paranasal sinus, face in center, and it will all can convert in cancer. Okay, rapidly spreading and destructing midline lethal granulomas can form. Okay, now angioedema, also known as Quincke's edema or giant urticaria. Urticaria means allergy or itching, like that. Okay, so in this our lips will swell like this. Okay, Quincke's edema and giant urticaria. Okay, rapidly spreading edema is involving lips, eyes, perioral structures, and chin. It is allergic disorder, and idiopathogenesis is dysregulation of mast cells, degranulation of mast cells, IgE mediated, and complement pathway activation seen in hereditary. Most severe form, if involve RT, respiratory tract, the person is dead. And GIT. Okay, complement pathway activation seen in heredity. And first is degranulation of mast cells, IgE mediated, because it is IgE is allergic. And third is ACE inhibitors, treatment of hypertension. Increased level of bradykinin acts so as vasodilator, hence collection of edema, seen in hypertensive patients who are taking ACE inhibitors. Okay. Contact dermatitis. It's also called as dermatitis stomatitis and dermatitis venenata. Contact dermatitis is also called as dermatitis stomatitis and means stomatitis is involving means contact dermatitis is an oral cavity disease. Okay, dermatitis venenata. Okay, allergic response to some contact allergen. Okay, allergic response to some contact allergen. Mouthwash, which is present in mouthwash, toothpaste, restoration material, food spices, chewing. Example, food spices like cinnamon. Okay, cinnamon is the most common example in which increase in plasma cells occur. Plasma cell gingivitis can occur, and allergen is hapten is, okay, I've written it in the most confusing way. um, APCs, okay, antigen presenting cells occur Langerhans cells present to T lymphocyte, which cause destruction and inflammation of skin and oral cavity. In skin, it is called as dermatitis. In oral cavity, it is called as stomatitis. Okay, it will cause edematous lesion, which is painful if eroded. Okay, so APCs occur Langerhans cells form in bone. APCs which form or also called as Langerhans cells, which forms in bone and reach to mucosa or skin. Okay, which is an allergen and hapten present to T lymphocyte. It will present to T lymphocytes, which cause start destruction and inflammation. In skin, it is called as dermatitis. In oral cavity, it is called as stomatitis. Skin wala most common hai, and it is an erythematous lesion. It is painful if eroded. Okay, thank you. This is how our allergy and immunological disorders of oral cavity are completed. Thank you.